Public health officials believe it won't be long before the U.S. sees mosquitoes carrying Zika virus, which has been linked to birth defects. Dr. Jon LaPook shows us how Brazil is fighting back.
The Brazilian town of Piracicaba is taking a very different approach in its battle against Zika. It's fighting mosquitoes with more mosquitoes, millions more.
We release 800,000 mosquitoes per week in this neighborhood.
But the mosquitoes that biologist Cecilia Kosman releases are genetically modified by a British company, Oxitec, to contain a lethal gene. In order to survive, the engineered insects need an antibiotic, which they receive as they're raised in the lab. Then they're released so they will mate in the wild. Outside the lab, without the antibiotic, they die, as do their offspring who carry the same lethal gene.
If you fight the mosquito, you're fighting every disease that mosquitoes can transmit.
The Aedes aegypti mosquitoes can breed in almost any standing water. Drainage ditches, the bottom of a trash bag, a simple puddle. Breeding sites are constantly monitored. A second gene alteration makes the larvae fluorescent, so they're easy to count. The company says the larvae population in the area dropped by 82% in less than a year.
We know we can eradicate the Aedes aegypti mosquito.
Dr. Peter Hotez is one of the leading tropical disease experts in the world. He says an aggressive international campaign led to the near eradication of Aedes aegypti back in the 1970s, but the species has rebounded.
I think, we can evaluate these new technologies. It's worth evaluating them at scale, but that should not stop efforts right now using traditional methods.
Key West, Florida has applied to the FDA to conduct a test using the same mosquitoes, but some residents are fighting it, saying it's too soon to understand the environmental impact.
Fascinating. John, thank you.